Hi, I'm Dr. Sunil Richardson, maxillofacial and craniofacial surgeon. One of the commonly asked questions is about costing for surgical procedures. I have to tell my subscribers that this costing for various facial procedures is not uniform. There are multiple reasons for this. It's not just because of the position of the hospital, the city that it's located, or it's not only because of the team that are involved. There are multiple factors. Let me just start with the example of rhinoplasty. Already I have mentioned to you all that rhinoplasty, there are different types. So I could finish a rhinoplasty in as little as 30 minutes to a rhinoplasty that can take me up to 3 hours. A big factor in costing. Time for surgery, what exactly is done? That is a big factor. What about the second factor? Second factor is the location. For example, if you want to get a rhinoplasty done in one of the leading hospitals in New York, or in Muscat, or in Nagercoil, or Delhi, so depending on the city, the rates do vary a lot. And the reason is because as the cities vary, so are the corporate hospitals, the facilities, the norms involved, the NABH accreditation, the JC accreditation, be it whatever it is. So generally rates vary across cities, vary across countries, definitely. In some countries, you'll have to pay with a strong currency like Omani Riyal, and in some you could pay with a weaker currency like the Indian rupee. That's another thing. Standard of living, the quality of medical care for the money that you pay, I think is one of the highest in India. Maybe some other countries also in Asia or maybe Brazil. I'm not sure about those countries, but definitely India. So that's the second factor that comes into play. The third factor again is variable. Certain surgeries, especially when we talk about jaw surgeries, we have to use implants. For that matter, even rhinoplasty. So implants vary. You have alloderm that costs us $1,800 to some of the plates and screws that just cost you $20-30. So depending on what implants you use, which make, what quality, what type, the cost escalates or comes down. That's a big factor again in facial maxillary surgery. What are the implants that are used? The experience of the surgeon is another factor. Another factor that comes in is the institution. Is it a charitable one? Do people really want to help out somebody else, or is it just for profit? All of these factors are minor factors that play in the overall costing. But costing therefore is varied, and I really request patients, whatever surgery you seek in any part of the world for that matter, to be giving all details or ask at the time of consultation what it would be. At the hospital, Richardsons, we give the patient an estimate when they walk in based on the surgery that we're planning and the estimated days of stay. Yes, that could be a little bit, that could also vary a bit, but at least you get a very good idea with that. So the bottom message is costing for any particular surgery varies a bit from place to place, also varies by the surgeon who operates for you, varies at the hospital where you get it done, varies depending on the procedure, how long or short, or how complicated or simple, and also finally depends if they have a charitable motive behind it. We do a lot of cases even for poor patients at Richardsons. We take care of them because it's one of my philosophies to help people who can afford also. There's a lot of intangible income in treating those patients, but it really varies. There are a lot of corporate hospitals who will only take in patients if they're able to have that much minimal amount of payment. So I think I've tried to explain the nuances and the differences in why the costings are there for various facial surgeries, and to get a precise estimate for your own tailor-made surgical plan, you must send your photos and x-rays or scans to a WhatsApp number or email us. That will solve a lot of hassles and unexpected, or that will solve a lot of issues as far as your estimates would concern. Thank you.